Good afternoon, everyone, and want to welcome you to this webinar. I'm Katie Boyle, for those of you I haven't met. I'm Director of Government Affairs for the Virginia Association of Counties, and I'm joined today by my colleagues Carrie Walker and James Hutzler, who are helping out with this webinar. We're very pleased to be hosting this event jointly with our partners at the Virginia Municipal League. So I'll be handing the floor to Janet Arison with VML momentarily to introduce our guest speaker. This afternoon, we're very pleased to welcome Ryan Kelly from the Virginia Department of Social Services. He will be sharing an update on a project that he and his colleagues have been working on for several years now at the direction of the State Board of Social Services to develop a potential alternative allocation model for local administrative funding. We've had several discussions with Ryan and his team as this proposal is being considered and discussed internally, and they're now ready to share an update with a broader audience. So a couple of quick housekeeping items. We are recording this session. We'll make the recording available on our website along with the slides. If you could hold questions until the end of the presentation, we'll ask you to indicate in the chat that you have a question, and then we'll have you unmute and ask your question. I think that might be the best way to handle it since we've got a lot of people on this call. And then lastly, this is the first part of a two-part series, and the follow-up session will be on December 11th at 1 o'clock. So now let me turn the program over to Janet Arison with VML to introduce our guest speaker.
Hi, everybody. Happy to introduce to you our speaker today, Ryan Kelly, who's the Assistant Deputy of Policy Administration for the Virginia Department of Social Services. And Ryan has a really impressive resume, which I won't read all of it because you would all be so depressed about how much we all haven't done in our lives. Well, maybe some of us would be that way. But anyway, Ryan's worked at the local, state, and federal levels of government, and he's also worked in the nonprofit sector as Vice President of Operations for America's Kids Belong, a national nonprofit dedicated to empowering people at all levels to address foster care in their communities. He's also worked ran a small public affairs firm for a few years, and he has also served in the U.S. military. And DSS is, they're lucky to have him. He has such a great amount of experience in all different areas, and Katie and I have enjoyed getting to speak with him over the last several months on this project, and I will go ahead and turn the floor over to Ryan.
Well, good afternoon, and thank you, Janet, for that introduction, and I appreciate being here. Again, my name is Ryan Kelly. I'm the Assistant Deputy of Policy and Administration, and I serve under Deputy Commissioner Gina Boyle here at the Virginia Department of Social Services. And I'm here today to provide an update and an overview of where the department is on developing a new local-based budget formula. As you can see, and as Katie mentioned, this is part one of two presentations on the draft formula. This is not an easy conversation, and it's riddled with complexities. So today we are just going to start the next iteration of this conversation with a high-level overview of the formula, its main factors and mechanics, and in a couple of weeks we'll come back to the formula with a deeper dive into more detail on how the formula works. We're going to see a lot of the same content in a couple of weeks, but we are going to take some time to really kind of go through some of the math in more detail. But today, just the beginning, and I'm flipping between a few slides here. It's our monitor, so bear with me. But in doing and going through the presentation today, I'm really going to follow this outline that you see here. I'm going to provide a brief introduction to set up the context for this formula change. Then I'm going to go and discuss the draft formula itself. From there, I'll pivot to next steps, and we can close with your initial thoughts and feedback on this afternoon's presentation. Before we get started, I want to acknowledge a few assumptions and aspects of the formula in advance of the presentation. First, we want to thank the many internal and external team members that have been a part of this journey. We have had a lot of help internally within the Department of Social Services from several divisions, but we've also had great participation from several directors from our local departments who's joined us on a working group And we've also had great participation from our local departments through multiple focus group discussions that we had on this topic this past spring. And I'm going to explain the focus groups and working groups a little more in a minute. But through the working group and through the focus groups, we've really tried to make this an inclusive and collaborative process with our colleagues and partners at the local level. And today, as Katie mentioned, we are expanding this conversation to include all of you from the Virginia Municipal League and the Virginia Association of Counties. And so I'd also like to thank Katie Boyle and Janet Arison for their engagement with us on this topic and for their efforts to set up today's program and the one coming up in a couple of weeks. Secondly, we know, as I mentioned earlier, that this is not an easy discussion. Funding for staff and operations is a very sensitive topic for good reason. And balancing the sensitivities of 120 local departments, 120 localities, is very complicated. Somehow coming up with something that works for the good of the whole, or the common weal, as we say here in Virginia, is no easy task. The conversation about a base budget formula change has always included discussions about how a change will make allocations for some localities higher and other localities lower. That's why in the past, this discussion has come to a halt when considering a formula or implementation that would reduce even one local department's funding. Acknowledging that complexity and sensitivity, our proposal and recommendation will involve two important provisions that we want to announce up front. We start by admitting that the current base budget is insufficient to meet the true needs of our local departments, and that has come up in the working groups, it's come up in the focus groups, and that inadequacy drives this tension around the change. And so that is why we are going to propose to accompany a new formula with a budget request to increase the overall base budget pot. We'll get to that request a little later on in the presentation. The other thing we want to be clear on from the beginning is that we intend to keep all localities throughout this transition at the base budget level that they have today. That means, again, acknowledging the sensitivities, the complexities, and the dependencies that exist around this funding. Our plan proposes that there is no reduction to your current allocation going forward. Lastly, we want to open by saying that what we present today is a start. It's a recommendation. We have had several iterations to get to today's draft, but we're not done discussing and thinking through what we ultimately submit. We think that what we offer today is a good start point from our work to date. But that doesn't mean it cannot change. You might recall a past idea on this subject, or you might suggest that we tweak this or tweak that. And we are very open to hearing those ideas as this process continues. And as we close this presentation, we will provide a way for you to continue submitting feedback. We really consider our road ahead of us as a ways to go. We still have a long ways to go. So with that said, let's run through some background to help set up what we are presenting today. Approximately 85 to 90% of the current staff and operations funding is allocated based on an out-of-date formula that is so old that it predates current staff. It's unclear what that formula is based on or was based on. However, it's also important to note that in the last decade, new staff and operations funding has been allocated based on caseload standards. This is only 10 to 15% of the current staff and operations funding. It includes funding for Medicaid expansion, eligibility workers, and family services specialists. The vast majority of funding is allocated based on a formula that's over 30 years old that no one really knows how it got started. So that's why this conversation is so important and has continued to come up over the years. In terms of the current allocation context, I want to make sure we all understand that we're talking about reallocating the local base budget. In fiscal year 2023, the local staff and operations base budget was $512 million. That's a lot of money. It's essential to local departments, and it's made up of federal, state, and local funds with a local match of an average of 15% provided by our 120 local departments. Although pass-through funding, which is federal and local funds only, and we know they play a significant part in staff and operations, but we're only talking about reallocating the base budget, which again is this $512 million from the fiscal year 23 pot. We don't take pass-through spending lightly because we know that pass-through is critical to most local departments. We're saying though that we're not reallocating pass-through funds. We're simply stressing that we're talking about the local base budget pot. There are only two budget lines in the staff in the base budget. We're talking about budget line 849, staff and operations, with no local match, and then budget line 855 that does include a local match. These two budget lines, the $512 million that I just talked about, and together again have that 15% local match average. So that's what we're talking about reallocating. I hope this provides some context on the actual funding that we're discussing as we go forward. I do want to talk about how we got to today. This is actually a conversation that has come up more than once over the last 30 years. Most recently, the State Board of Social Services asked then Commissioner Duke Storen to look into this in 2020. To answer that request, Commissioner Storen established the reallocation of local staff and operations funding working group. The working group was responsible for defining equity as it relates to the funding of local departments. Equity the group discussed really seeks to provide an equal footing or opportunity for success for each individual locality. And so that does not necessarily mean an equal allocation. The work group was also charged with proposing and evaluating new allocation criteria to help ensure the equitable distribution of funding. We were collectively assigned to decide on the new criteria and its fitness into a new formula. And we were charged with developing new allocation methods or models that include these new criteria. And lastly, we were asked to make recommendations to senior management regarding allocation methods and the implementation of those methods. After a change in administrations, some internal discussions, and an update to the state board, Commissioner Avula asked that we really hear from every local department on what they thought should be included in a new formula. And so this past spring, through the work of our local engagement and support division and our Office of Research and Planning, the department hosted 10 focus group sessions, 2 per region, and 19 individual focus groups. As an alternative, we also offered an online survey, which asked the same questions that we asked in the focus groups. We had 105 of our 120 local departments participate, or an 88% participation rate overall, and we collected more than 500 pages of material to analyze. When you look at these two bodies of work, the working group effort and the focus group, what emerges are the results listed at the bottom of the slide. Caseload data was recommended to be a foundation for future formulas. Poverty should be taken into account, and so should fiscal stress. A new formula should drive toward equity, offer transparency, stability.
Here in the backyard, in the background.
Excuse me. And a new formula should, I'll repeat myself here, a new formula should drive toward equity, offer transparency and stability into the future, and as much as possible, be responsive to the needs of local departments. Further, this conversation should include a wider audience for discussion and be implemented in a way that allows time for localities to adjust to the new formula and allocation. So let's get into the draft formula. Again, we start from the premise established by the state board that we draft a new formula and make an effort to improve equity as we do. So again, in our work on this so far, what has emerged is the direction to use caseloads, poverty, and fiscal stress in designing a new formula. I want to break into these factors a little further, starting with poverty. Specifically, we looked at ALICE data from the United Way. ALICE stands for Asset Limited, Income Constrained, and Employed. And this measure really spells out poverty just beyond the federal poverty level in a population that is struggling to meet an adequate family or personal budget. Ultimately, we decided that ALICE was problematic because it's difficult to include in the calculation. It has some negative unintended consequences. And lastly, it's not universally agreed upon or understood across our social services network here in Virginia. When we looked at alternatives like poverty case counts, we found correlation results that indicate that allocations based on weighted caseload are very well aligned with differing poverty population counts across localities. This was looked at over multiple years. These findings suggest essentially that introducing poverty counts into the formula would have little to no impact on addressing differences in poverty populations across localities. And so internally, and then through discussions with the working group, we decided that poverty is already a consideration within our caseload data. So in terms of the actual math, that takes us to weighted caseloads and fiscal stress. Caseload data is recorded to federal information, according to Federal Information Processing Standards, FIPS, for the 20 programs tracked by VACMS or OASIS and other state and federal tracking systems used for social services. Using these results, you can view the percentage of observations sampled for each of the 20 programs, thus being able to weight dollars by program. Locality caseload data is then used to allocate staff and operations for each program by locality. The sum of each locality's allocation for each program equals their total allocation. Weighting caseloads can provide a more equitable allocation by taking into consideration variances such as the amount of time required to enroll a Medicaid recipient versus maybe the amount of time required to complete a Child Protective Services investigation. Again, this was a factor highly favored in the working group discussion and the focus group data. Excuse me. We also looked at how to include fiscal stress, and ultimately we looked at the Commission on Local Government's Fiscal Stress Index, or SCORE. The Commission on Local Government describes the Fiscal Stress Index as illustrating a locality's ability to generate additional local revenues from its current tax base relative to the rest of the Commonwealth. The average fiscal stress score across Virginia is 100.3, but in some cases as high as 106 or as low as 91. Higher fiscal stress or a lower ability to pay into cost is associated with a higher score, and low fiscal stress with a low score. So, for example, a score of 100 indicates the locality has fiscal stress equal to the average Virginia locality. But if a locality has a higher score than 100, that indicates their fiscal stress is greater than average, and vice versa if it is lower. This score may ring a bell for some of you. It was part of the historical CSA local match formula. It is also used by the VRS, the Department of Education, and other agencies for similar purposes. While the index is updated annually in comparison to caseload data, there is a lag due to data collection. The index has three main components, which are averaged together to produce a total score. Revenue capacity per capita, which is how much tax revenue a locality could collect per person from its base if it used statewide averages. Revenue effort, its own source revenue collections divided by its revenue capacity, and then median household income, the level at which exactly half of the households in a jurisdiction can earn more and the other half earns less. The fiscal stress score is designed in such a way that it is relative, and it's also designed with the distribution of state aid in mind. Now that we have some background on the key factors, let's get into the actual calculation. And if I need to move around to get the light back on, just let me know. There it goes. So let's start by allocating base budget funding by weighted caseload as discussed in the previous slide. That's our start. With weighted caseload as a foundation for the new formula, we are proposing to address equity in each locality's ability to pay by including the fiscal stress score in the formula. We would map the most recent fiscal stress score available from the Commission on Local Government based on FIPS to the 120 local departments. When FIPS codes need to be combined for some local departments, we create a weighted average fiscal stress score for those local departments. Introducing the fiscal stress score into the formula modifies the weighted caseload allocation through an increase or decrease in the final allocation amount. And this will depend on how far a locality's fiscal stress score was, higher or lower compared to the weighted statewide average fiscal stress score. So what does this mean? What does this do? Well, if a locality had a high fiscal stress score, a score indicating it would be difficult for them to generate local funding, they would be allocated an additional amount that is tied to their weighted caseload allocation and proportionate to how far they are from the statewide average. And the opposite would be true for those who have a low fiscal stress score. They would be allocated slightly less than what they would have received if weighted caseload was the only factor in the formula. The idea behind introducing a component into the formula that measures the fiscal stress of a locality is that it recognizes that each locality may have more or less difficulty in receiving local government funding based on their distinct tax revenue, their revenue collections, and household income characteristics. After calculating allocations based on the new formula, funding increases for each locality that would receive an increase are noted. These are increases in comparison to the current allocation. Funding levels are then reset so that current funding levels remain the same. The identified funding increases are added together to become the accompanying budget request. And if received, that funding would be applied to localities who would have received an increase under the new formula. When we look at the impact of a reset provision, we see that slightly over half of local departments would be held to their fiscal year 23 base budget amounts. Those are 63 to be exact. And based on these new allocation amounts, 57 local departments would expect to see an increase in their fiscal year 23 base budget. To be able to keep every local department at least where their base budgets were in fiscal year 23 and provide the funding to the 57 local departments who would have received an increase over their fiscal year 23 base budget, we would ask to receive a $55.5 million, we would make a $55.5 million budget request with this weighted caseload and fiscal stress adjustment allocation. Again, this is a high-level overview of the formula, its factors, and how it works. We know that this might beg several questions. The first being, what does this mean for me at X locality? And we fully intend to provide that information, and you will see in the upcoming slides how we plan to do that, or when we plan to do that, and provide a more detailed description of the formula. Today, we just wanted to introduce the formula at a higher level before providing that deeper dive. In the focus groups and in the working group, it was discussed and recommended that implementation of a new formula should be done in a way that allows for localities to prepare for the pending change. First, let me just go back to our formula roadmap. We've shared this with our local departments at the September commissioners call. So we've drafted a model formula, and we are now in that vet phase that you see here in yellow. We will keep our focus on vetting the draft formula with our stakeholders through the end of February. In March and June, we will review, March through June, we will review the feedback that we receive. And to the extent we can, we will make adjustments and review then the final draft. And then in July of next year, our plan is to request approval from the Secretary of Health and Human Resources to submit a new a decision package, as the annual preparations for the General Assembly session of 2025. We would hope that in the following winter and spring of 2025 that the governor and the General Assembly will approve the formula change in the associated legislative and budget packages. Lastly, our proposal suggests that the formula change go into effect as part of the new state fiscal year of 2028. So that would be in July of 2027. In between 2025 and 2027, the department would work with localities to prepare for this adjustment. The formula would be updated every 2 years, beginning in 2029, and new funding would be applied through the new formula. terms of next steps and feedback, as part of the vet phase, we will continue to work with our stakeholders to create an understanding of this draft recommendation. On December 5th, 11th, and 12th, we will provide the second part of this presentation and go over in more detail how the formula works. On December 5th, we will be hosting a webinar with our local departments in the northern, eastern, and central regions. On December 11th, we're coming back here to VML and VACo. And on December 12th, we will host webinars for our Western and Piedmont regions. Excuse me. It doesn't mean that you can't start providing feedback. Throughout the vet phase, we will be collecting feedback, and at any time you can email the department on the draft formula at this email address. So this concludes my presentation. I just want to finish again by saying thank you for all the participation and engagement. This is a very challenging conversation, but your partnership will really help to define how to go about this change and improve upon it. So with that, I am going to stop and just open it up for any initial feedback and reaction to what was presented today.
Thank you, Ryan. Really helpful presentation. So I would ask if people could, folks who have feedback or questions could just sort of indicate that in the chat, and then we can kind of call on folks. Looks like we've already got one question. Can you put up that email again? Or maybe we can type it into the chat too. Pamela, do you want to unmute and ask your question?
Sure. Can everybody hear me?
We can hear you.
Okay, I got a bad cold.
Oh.
Just for clarity for me, the part about having the formula reassessed every 2 years does that mean that if the formula is adopted and based on the formula, each locality in terms of what our numbers are outdated will be assessed every 2 years?
That's correct. I mean, one of the asks of that came to the focus groups, I think, and generally from this conversation is that we're trying to avoid returning to this place of, how do we allocate this funding? Obviously, what we're funding today is, or how we're allocating today is based off of a 30-year-old formula, and it is outdated. We're uncertain how it works, and so what we're trying to do is create a formula that allows us to really be able to draw current data as often as necessary to make sure that the formula stays updated. So what we would propose, the caseload data is something that we can pull on a pretty routine basis. We can pull fiscal stress scores on a routine basis as well. And so we would suggest that we would update the formula every 2 years with new data to keep it current.
And then the last question, a follow-up with that. So when you mentioned earlier about localities funding right now not changing, would it eventually change to go, is there a possibility of it changing to go below to what we're getting now once the formula is adopted? You know what I mean?
Sure. And we've taken that point came out in the previous presentation that we made to the league, that what happens in sort of an economic downturn. And I don't have an answer on that for today, but that's definitely something that we're going to be kind of going back and thinking through. What would happen if there was a reduction? That's a good question.
So when you talk about the funding not changing now, you just meant for fiscal year 24?
Correct. I think I think we need to work that through a little bit more, but what
Okay.
we're trying to say is that changes to your current allocation we will not make a reduction to that current allocation. Ideally, we are able to receive a budget increase and increase allocations where the formula suggests that.
Thank you.
I'm going to take one question out of order here because I know the answer to it. I got a question about would we share the PowerPoint, and we will definitely, I will email that out to everyone who registered because we'll have your email address, and then we'll post it on our website, and I imagine VML might do the same. Janet can correct me if I'm misspeaking.
No, you were absolutely right.
All right, great. So that might be a question that others had. So back to in order here, Toya Taylor asked, did I miss the actual draft formula? And if so, can you please share again? So Ryan, maybe you could sort of walk through that slide again.
Sure. Okay. So again, what we're proposing to do here is essentially calculate the formula by weighted caseload. So we would start by taking the full pot of that 512 million, break that down by program and then by county. Your total for each program, each program is allocated, and then your total for each program becomes your local allocation. Then we lay on top of that your fiscal stress score. And again, if your fiscal stress score is above the average, you have a higher fiscal stress. You would see an increase over your weighted caseload allocation, and then that would become your total allocation. We're going to explain that in more detail in a couple of weeks. But the opposite is true if you have low fiscal stress. If you have low fiscal stress, we would lie that over your weighted caseload allocation, and that would essentially remove some funding, and that would become your total allocation based on that fiscal stress influence on the weighted caseloads. I know that's still probably a little fuzzy, but we're going to come back to that in a couple of weeks and really provide a more detailed explanation on how that is calculated in more real numbers.
Okay, looks like a question from Suzanne Adcock Nicely. Suzanne, do you want to pose your question?
Sure. Are you guys going to release the specifics on the individual localities? Because I'm assuming you've run these numbers since you know where everybody sort of is going to fall. And I just wanted to see if those are going to be available.
Yeah, our intent is to provide a letter for each locality with just, again, some more background on the formula, and then to sort of provide how the numbers look for each locality today, and then how that would calculate an allocation based on those numbers. I want to remind everybody that will. We're going to try to spell this out in the letter that allocation, or that what we do in that letter is just based on what we have in terms of numbers. It's subject to change based on changing data, depending on when the formula is implemented, and it does not. And we also have to remember that we have a reset provision that resets your allocation to today's allocation. But yes, we do intend to provide a breakdown per locality on how this plays out.
Thank you.
It looks like the next question from LA Green is somewhat of a follow-on, asking when exactly we should expect to see that updated formula and the effect on individual localities.
So,
LA, did I capture your question?
Yeah, so I think going back to sort of what we would propose in terms of an implementation, this has to run through the legislative channels, through a General Assembly session. It has to become, I think, a part of the governor's budget, and so we have to kind of think through like the cycle of the legislative work that's being done across the state. And so if this could take off into the 2025 session, we would hope that it would go into effect then in 2027, into the fiscal year 28 budget. So we would propose that there be a couple of years between when this is introduced and then when it takes effect. And right now, what we would suggest is sort of this 2025, 2027 framework. And so then you would start seeing an effect in the fiscal year 28 budget.
Question from Charlene Collins about local match. Charlene, do you want to pose your question?
Good afternoon. I'm sorry I didn't catch the beginning of this presentation. My question is about the local match. Most agencies have that 15.5% local match. Just wondering, does that affect that number at all?
I don't know that it does either way. That's something I'm gonna have to come back to answer. But we do hear, what would this do to the local match? And it's something that we're paying closer attention to as we continue this conversation.
Okay, thank you.
Sure.
Another question from LA Green. You want to go ahead and unmute?
I've asked so many questions. Hold on. Let's see. I think the question you may be referencing is, will there be any narrative or explanation associated with the updated impact? And the gentleman, Ryan, did indicate that there would be some individual narrative in the letters.
Yeah, what I would say is we're going to have a narrative, but the numbers will be tailored to the locality. The narrative, not as much. That'll be more of a sort of a broader explanation of the formula. A lot of material that you heard here today will be repeated in that letter.
Okay, thank you.
Sure. Just as some background, if you're not affiliated with the presentations.
Thank you.
Okay, Annie Ross is next up.
Hi, yeah, I was just wondering, sorry about that. I was just wondering about how specifically you all were calculating revenue capacity, or where we could find that calculation. I know that you pointed to the fiscal stress index from DHCD, but they don't really go into detail about how they calculate revenue capacity. JLARC just did their own calculation of how they would do revenue capacity for education funding. And I was wondering, are we using that? Are we using DHCDs? And if so, do you know where they have a more detailed breakdown of how they calculate revenue capacity?
Sure. And one of my colleagues from the Office of Research and Planning and I just typed it in, but she links the DCHCD. But this is if you go to the Commission on Local Government, they have a fiscal stress report that comes out, I think, every 2 years. But I would reference that document to kind of really look more deeper into how fiscal stress is calculated.
Okay, Tom Little next up.
Yeah, my question is that, well, when we're preparing our budgets locally, I think the first thing when we're doing a budget for staff and operations, the first thing we look at is, the number of approved positions, and your budget is built around that. And I was wondering, at any point in this process, did you consider looking at the number of approved and funded local DSS positions and making that part of the allocation methodology?
Tom, that's a great question. The working group went over several factors. I do recall, the number of people per local department coming up in a group setting where I was making a presentation, but we did not, consider that with great depth, but it's something maybe we can go back and look at. We really have focused on, some of the factors that we talked about today: poverty, fiscal stress. We looked at unemployment. We looked at a couple other indicators of what was happening at the locality, but not in depth on actual personnel numbers per department. So
I think it would be helpful because this is a process that, every local government, every state department, every local government, and, they're already doing this every year. We have to go through and, once again, just validate the number of approved positions, and we're requesting these funds every year. So it's data that you get every year, and every locality has approved X number of positions for their local Department of Social Services, and it's in their budget, and that data is available, each year, and you can see how many positions for each locality has approved and funded, and it seems like that would be a very simple way to divvy up the allocation for the state.
thanks, Tom. Appreciate that.
Any other questions or comments? Well, I think seeing none, just want to remind folks who, here's a comment, the size of locality needs to be considered. That's from Eileen Smith. Eileen, do you want to expand on that?
Well, I think I'll also say that it's not only the size or the number of the staff that you have, but what size of the locality, how many citizens are you serving? So it's not just about poverty level. It takes so many people or so many staff members to serve my size of locality. And so I think that's a part of this as well. Somehow it has to be looked into. If I go into fiscal year 28 with fiscal year 24's budget, that is not going to be healthy for me. I'm going to have some issues, which will, according to what you're saying, potentially increase what my locality's contribution is. And that right there is of great concern, because we also have to watch how our budgets are with the localities and if they're going up or down. And predicting this.
Eileen, I'm having a hard time hearing you. I don't know if you can speak up, but I want to make sure I'm capturing this.
Okay. Can you hear me now? Or is it still fuzzy?
A little bit bad. I just turned my volume up. That helps too. So
okay. How's that?
That's better.
Okay.
Thank you.
So basically, that's all I'm saying, is that it relates to not only how many staff members you have and how you have to pay for those, but it's going to relate to the size of your locality. For example, Fairfax, Virginia Beach, some of these others, Richmond, Chesterfield, and all of these places, we have a huge amount of citizens. So that being taken into account would be a great, at least I think it should be.
Okay. Well, thanks. I appreciate that. I mean, we really hope that, some of this is captured in weighted caseloads. If you have a larger population in the locality, typically we're seeing sort of those caseloads sort of match in proportion to what's being out, what's within the general population. So, but yeah, we can. But that's a good suggestion. Thank you.
Also, a question from Annie Ross. Annie, do you want to?
Sure. My question was just if there would be any regionally based cost of living adjustments built into the staffing costs.
Annie, we don't have plans to do that. That's something we can look at as part of our follow-up here from this initial vetting.
Well, it looks like the questions have dried up for now, but there's an opportunity to provide feedback through your email address that's on the screen here, and that's been in the chat also. And just as a reminder, we'll be hosting a follow-up webinar on December 11th at 1 o'clock. I know many of you are registered for that one already, but certainly an opportunity to register and have some further discussion with Ryan and his team. And Ryan, I want to thank you on behalf of VACo for coming to walk us through your plans and to solicit some feedback. And I really appreciate it. I'm going to hand it over to Janet for any concluding thoughts. So thank you again.
That would be my concluding thoughts too. I also put a link in the chat about the Commission on Government and its fiscal stress. It's the FY21, but it's the most recent report, but it gives an explanation about revenue capacity and how they get to the numbers they get to, if that's of any interest to anybody. That's all I have, and I appreciate you being here, Ryan. This is really helpful.
Thank you. See everybody in a couple weeks.
All right. Thank you so much, and we're adjourned for now. See everyone on the 11th.